Welcome back to our how-to series. Today we're going to be talking about medicating your cat with oral medication. There's definitely a few challenges that we do face when giving oral medication. Firstly, knowing how to hold your cat and handle your cat during the process. Secondly, how and where to aim the medication. And thirdly, being sure that the cat does swallow the medication and doesn't spit it out.
Every cat is different. Some are quite manageable for procedures like this, and others are a little bit more resistant. If your cat has a good appetite and isn't too picky, then offering the pill as a treat is a great way of making it a more positive experience. Wrapping the medication in something like deli meat, wet cat food, or a pill pocket might work quite effectively. Our clinic cat Daphne has her medication every day in her wet food, so that's a great technique to make it a more positive experience if your cat has a good appetite. If not, they may require manual administration, which is what we're going to demonstrate in this video today.
So during the process, it's very important to keep your pet as comfortable as you can, and just to make sure that everyone involved is safe in the process. So if your cat does tend to be aggressive for handling, using a thick towel to wrap them in can be a really good way to protect you and just to keep your cat secure.
So before we get started, there's a couple things to make sure we have. The first thing is, of course, the medication. You want to make sure it's the right medication and the right dose. So always check the label. It's always worth double checking. If you have any concerns or questions, absolutely give our office a call and we're happy to help you out. The second thing that's useful to have is a syringe of water. We just have a syringe here that we filled from the tap. And the third thing is a helper and or a towel, like Amber said, to wrap your cat up if needed, and some tasty treats to, again, try to make the experience a little bit more positive.
So we're going to start by securing our cat in an upright position here. Now, if they do tend to be a hands-on type or aggressive, which he's trying to tell us he doesn't particularly like being here today, we do recommend wrapping them in a towel just to keep you safe and to keep them secure. So what you want to do is just fold up the bottom of the towel to keep their feet from coming out, and then give them a nice secure wrap around the back of their neck there. So now he's kind of fussing a bit right now because he doesn't particularly like to be handled this way in the clinic setting. The next thing you're going to want to do is find these bones underneath the cat's eyes called the zygomatic arch. So these can be helpful little handles that are built in to help support your cat's head when you're going to give the medication. So you may be worried about handling around their teeth. What you want to be worried about is the canine teeth, those sharp little fang teeth. But up front, their incisor teeth are quite small and a little bit easier to manage. Use your non-dominant hand to support their head and their upper jaw, while you use your dominant hand to open their jaw and position the pill down to the back of their mouth. So I'm going to open up Flynn's mouth here so you can see what it looks like. So we're going to aim the pill to the very back of the tongue, this concave area of the mouth. And we can just shut his mouth there to be sure he swallows, and then put a little bit of water behind that canine tooth just to make sure he's swallowing after we administer that. And always we're going to be giving little strokes in between, trying to make it positive and less stressful for handling. Now, there are some medications that it's really important to make sure they get water after, as some of them can cause harm if they get stuck in the esophagus. So that's one of the good reasons why we do give water afterwards. Now, some people may be a little bit tentative about putting their hands near their cat's teeth, which is understandable. So we do have a device called a pill popper that you can purchase at our clinic for just this purpose. It has a little rubber tip at the end, and it's a plastic dosing device so that you don't need to put your fingers into the mouth. So it'd be very much the same, using your dominant hand to open the mouth and then putting the pill popper at the very back to get the pill in.
Now, some owners worry about the medication going down the trachea and into the airway, and while this is technically possible, it's very unlikely because the cat has the epiglottis and the laryngeal folds that protect their airway. So while that is technically possible, if you follow the steps of this video, your cat should be protected from having that happen.
If at first you don't succeed, you can always try again. Sometimes getting the technique just right can be a bit of a challenge, but with a positive attitude, knowing you're doing what is best for your cat, you can do it. You can try to make this a positive experience every time by starting and finishing with pets and snuggles and treats to make sure that they associate medicating with a happy bonding time with you rather than something really uncomfortable.
Thank you so much for watching this video. We hope you subscribe to our YouTube channel for more how-to videos like this, and we'll see you next time. Thanks!